Hi, good morning, Brian. My name is Margot Taylor. I'm your invigilator for the OET speaking session on the 7th of February 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Brian Ledger.
And what is your candidate number, please?
My candidate number is 311203431.
Thank you. And you are taking this test as an occupational therapist. Is that correct?
Yes. Correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Can you describe the journey that resulted in you becoming an occupational therapist?
My journey towards becoming an occupational therapist began when I was a child. My father was injured in an auto accident and had to go through many months of therapy. I witnessed the benefits that the occupational therapist and the entire rehabilitation team provided. And I was inspired by the way they were able to get my father back to work. This ignited my initial interest in the profession, which I confirmed by doing a great deal of research. By the time I entered college, I was convinced this would be the best profession for me. This prediction turned out to be accurate.
In your opinion, what characteristics an excellent occupational therapist should possess?
I believe the essential characteristics an occupational therapist must possess include empathy, compassion, endurance, and patience. The therapist needs to understand the situation the patient is facing, along with their frustrations, fears, and uncertainty. They must communicate positively, and with a clear goal for therapy that the patient can relate to. They need to be tough when a patient isn't cooperative, and gentle when the patient needs support.
How do you go about determining realistic rehabilitation goals for your patients?
Determining the rehabilitation goals for my patients is the most critical element of this job. The goals I establish need to be realistic, in terms of where the patient needs to get to, and their ability to achieve this. Appropriate goals result in therapy programs that are well suited for the patient, their families, and the workplace they will return to.
How do you go about establishing a rehabilitation plan for your patients?
Once I have established the patient's occupational therapy goals, I then need to develop a plan which will help them achieve their goal as quickly as possible. The plan has 3 phases which include the initial, advanced, and ongoing phases. The initial phase involves an introduction to therapy and checks to ensure that we're doing the right activities. The advanced phase includes more challenging exercises and activities, and a gradual narrowing of the scope to address the patient's specific needs. The final phase designs a program the patient can continue after the formal therapy has been concluded.
What methods do you use to deal with difficult patients?
Unfortunately, the majority of patients become difficult at some phase of their therapy. This is due to the challenges therapy presents, and the frustration patients feel by not being able to accomplish a task they were formerly able to perform. Recognizing this is the first step to dealing with it. When a patient becomes difficult, I back off on the therapy to give them a break. We then have a conversation about the challenges therapy presents, and the rewards the patient will realize if they stick with it and continue to work hard. If I think it will be effective, I can become even more demanding and challenge the patient to do more.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
Your preparation time starts now.
Excuse me.
Yes. How may I help you?
Can I have a name for the patient?
You can call the patient Paulson Kennedy.
Thank you.
No worries. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello, good morning. My name is Brian Ledger. I am the occupational therapist working in this aged care facility. Am I speaking to Paulson Kennedy's daughter?
Hello, Brian. Yes, I am Paulson Kennedy's daughter.
May I know your name, please?
My name is Margot.
Hi, Margot. Nice to meet you.
Nice to meet you too.
Margot, I am being assigned to do the occupational therapy sessions with your father.
All right.
Before proceeding to the session, I will explain how the session is going to be done.
Okay.
In your father's case, I will evaluate the cognitive abilities and assess strengths and weaknesses.
Currently, what all things you are going to focus?
I am going to work on the symptoms currently Paulson shows, such as decreased short-term memory, decreased problem-solving skills, decreased perceptual skills, problems with communication and language, and personality changes.
All right.
The need for evaluation is to determine his strengths, impairments, and performance areas needing intervention.
Okay. But how are you planning to do this?
I can understand your anxiety. I will explain in detail for you. During the assessment, your father will be asked to complete a selection of small activities and answer questions relating to recent and past events. During this time, I will analyze and determine if and where the patient's difficulties lie. And hence, I can arbitrate the best course of treatment.
May I know the activities you are going to conduct, please?
Sure, of course. I will give examples of the assessments to be carrying out. First one, name and address for subsequent recall test. That means, I am going to give him a name and address. After I have said it, I want Paulson to repeat it. I will ask Paulson to remember this name and address, because I am going to ask him to tell it me again in a few minutes. Address, for example, Mike Brown, 24 Tall Bay Street, Hampshire. He will be given a maximum of 4 attempts as well. Do you get me?
Yes, I do.
Other activities include, show the patient a sheet of paper with the 4 items that he has to be recalled later.
Oh, I see.
How it goes is, I will ask the patient to read the items aloud, giving a category cue, and ask the patient to indicate which of the words belongs to the stated category. For example, which one is a game? I will allow up to 5 attempts. Failure to complete the task indicates possible cognitive impairment. Or if the patient identifies all the 4 words, I will remove the sheet of paper.
Then, what's next?
The patient will be asked to remember the words in a few minutes. And the patient will be in distractor activity for 2 to 3 minutes, such as counting to 20 and back, counting back from 100 by 7, spelling world backward, etc. After that, the patient has to state as many of the 4 words as he can recall. Based on the activity, the assessment will be done.
Okay. All right.
Next is 3-word registration. Here, I will call Paulson's attention to listen carefully. I will say 3 words that I want him to repeat back to me, that movement itself. And he will be asked to remember the words. Passing on, I want him to draw a clock for me. First, put in all of the numbers where they go. When that is completed, say, now, set the hands to 10 past 11, likewise.
Okay.
These tests look simple for us, isn't it? However, people with memory impairment will find it difficult for them, and may not be able to complete the test successfully.
All right. I understand.
Finally, Paulson will be asked to recall the 3 words stated earlier. Say, what were the 3 words I asked you to remember?
Oh, I see. All right.
So, these types of activities will help us to calculate his current state.
Yes, I got it.
Based on the assessment, I can evaluate his condition. This will enable me to provide the plans or activities to help him to accomplish his task easier. Also, if necessary, care plan and notes to other healthcare providers can be prepared by me.
That's great.
All right. Then, may I proceed with the assessments for Paulson?
Sure, you may please.
Thank you.
That is the end of your OIT speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.